Hello and welcome back to Silvia's Health Hints for expats, tourists and abroad students. In the last two videos I was talking about medications to take with you while traveling. I mentioned also vaccines and vaccinations, so today I would like to talk about travel vaccinations. By travel vaccinations I mean vaccines or vaccinations which are recommended or mandatory for certain destinations. The travel vaccination recommendations are subject to regular updates. While the standard vaccinations or vaccines and boosters normally are covered by the public health system and by the private insurances, travel vaccines very often need to be paid out of pocket by the patient. If your trip is professional, if you do it for work, you have the right to ask your employer to cover the cost. It's very important that you inform in time about the current recommendations and requirements for your destination, because it can take some time to get an appointment, to get the vaccine, and so to be in time with the vaccination, it's important. In Italy, you can do travel vaccinations in public vaccination centers if you are a holder of the Italian health insurance card with tessera sanitaria. In these vaccination centers, the vaccines normally are already there, so you go there and you just get the vaccination. If you don't have the tessera sanitaria, then you need to do it with a private doctor, and this is a little bit different because normally the doctors don't have the vaccines in their offices, so they issue you a prescription, then you go to a prescription to a pharmacy. Normally the pharmacies don't have the vaccines on stock. They need to be ordered and then you need to pick them up and go back to the doctor. I have, for example, normally I buy the vaccines in advance. I have always the most important regular or travel vaccines in my office. But this means that I buy them in advance. I pay in advance for them, with also the risk that maybe if there's not so much request for some vaccine, they expire and I just lost the money. That's why be prepared that most doctors don't have them on stock in their offices. And now I will give you an overview on the most common travel vaccinations. The list may not be complete. It is, beside of this, it is also recommended to be up to date with all the normal vaccines. You know, the vaccines we do the boosters every 10 years, like tetanus, diphtheria, pertussis, poliomyelitis and all this stuff. Both the standard vaccination calendar and the list with the travel vaccinations you can find on my website in the section Information for Patients. There you have the complete list of the vaccinations. The vaccination calendar for children explains when the vaccines needs to be done, how many doses. The travel vaccinations is a list, and then you can click on every single vaccine and you can see all the information about how many doses, how long the protection lasts, and I also added something important if they can be done during pregnancy. So, which vaccinations are travel vaccinations? Hepatitis A, hepatitis B, vaccinations against tick-borne encephalitis. Then we have vaccines against meningitis. They also, they are not mandatory, but they also are part of normal children's vaccinations nowadays, the optional one. Rabies, which at the moment we have a shortage in Italy with this, so if you are in another country and you need it, don't do it better in your home country, because at the moment we don't know when it will be back. Poliomyelitis, yellow fever. I did a separate video about yellow fever, about how the requirements are, where you can do it, and Japanese encephalitis. These are the most common vaccines and vaccinations for traveling. Also the Japanese encephalitis at the moment, we have a shortage in Italy and it's not available. All the others, as far as I know, from the last weeks, everything is available and can be done. I hope this video was helpful for you, for someone who travels a lot. I wish you a nice trip, a safe trip. I thank you for watching this video and I hope to see you next week.